respiratory syncytial virus, where we had this massive resurgence at a weird time of year that we ordinarily wouldn't see it in the summer. And the thinking was the kids weren't interacting much, and therefore they didn't have build up much immunity to RSV, and then they all got exposed as they started getting together with devastating consequences. So we even had a lot of combined RSV and COVID co-infections in pediatric ICUs and pediatric hospitals over the summer here in the South. So they don't want to see that happen again with influenza. So the message is get your influenza vaccine in addition to your COVID vaccine, and you can get them at the same time. And so getting that word out, I think, is going to be really important. The narrative out there that's false, Shep. The narrative has been that this is an illness that's exclusively of older Americans, those over the age of 70 or 80. And we learned with this Delta variant over the summer, well, it was never true, and it became more apparent than ever over the summer with this Delta variant. I don't think the virus is necessarily targeting the kids. It's just that there was a massive firestorm because there were so many unvaccinated Americans with this highly transmissible Delta variant. So we have 30,000 hospitalizations of children so far.
Wow.
And 500 deaths. And that's a lot. And so the key now is, and not to mention all the long COVID effects, just beginning to get our arms around. So the need is apparent, and watch out for that misinformation, because the other piece of disinformation that you're hearing is that we're only vaccinating kids to protect the adults, and that kids are fine, and we're only using them as kind of cannon fodder to protect the adults, and it's nonsense. Kids need to get that vaccination. And so it's really good news. And hopefully shortly after Halloween, it'll be released to the public. But once again, I think we're going to see an uptake of the vaccine for the 5 to 11-year-olds. Here's why. So in the northern states, up in the Northeast, we're hitting 75-80% of the teenagers 12 to 17 being vaccinated. That's a sign that parents are going to be ready to vaccinate their younger kids as well, most likely, as opposed to where I am in the South, where you're looking at maybe 35 to 40% of the adolescents vaccinated. That's a sign that a lot of